Wow. That's a pretty good high school. Thank you, Selena. Thank you, Katie. And we are with you. We're sorry we let it go this far, but we are here to help you fix it. That's why we're all here. We're going to keep working on it. Till it's fixed. Thank you. Dr. Jim Peggs is from Physicians for the Prevention of Gun Violence, and he would like to talk to us today about what you're doing. Welcome, Jim.
Well, I think what I'm doing is preaching to the choir, actually. However, it never hurts to get kind of re-energized, and that's partly why we're here, is to keep our optimism up. So I guess the first question would be, if I were you, is why a doctor? What's a doctor doing up here? And what does a doctor likely know about guns and murder with firearms? Well, I'll give you a short story. First of all, I've had at least 2 personal experiences with patients. I was a family physician for 38 years, and at least twice I've had patients under my care. One was a young man who I thought was, on the surface, a handsome, athletic high school graduate who really hadn't been too sure about what he wanted to do with his life. He knew enough about his family background, because I cared for his parents and grandparents. But to cut to the chase, he, one evening, while drunk by himself, got his father's handgun and put it to his forehead and pulled the trigger. And survived, miraculously, to the point where he actually could go back to work, and he started to raise a family. Ultimately, I have to say that he successfully committed suicide the second time. That time not with a firearm, but it certainly drove the point home to me as a physician that my patients are out there and we just don't understand what's going on inside and what the risks are. Another was an older gentleman who had felt he had lost his physical ability to be very useful to his family, and took advantage of having his firearm, a handgun, nearby in his bedside stand, and finished his life. Those are only just a few examples. I have many physician colleagues in our organization who have had to take care of patients, who've had to have that awful talk with families in the emergency room after somebody has died. So there is plenty of reason for physicians to have had personal feelings and experiences about gun violence, not to mention many of us in our communities. It's not very many degrees off from where we live that we probably know people, not directly but indirectly, suffer the effects of gun violence. So, PPGV, Physicians for Prevention of Gun Violence, got established somewhere around 15 years ago in the aftermath of one of the early mass shootings. I think it was the Gabby Gifford shooting. Actually, it wasn't a mass shooting, but it was a very highly political, visible. And because we all have felt that too many of our patients have lost their lives because of this unimaginable crisis we have. And I'm going to use the term crisis because we consider that gun violence is just as much a public health crisis as we have seen in the past 100 years in this nation, whether they're terrible epidemics, including COVID, pandemics, the opioid crisis we work our way through, cancer, highway deaths. We, as a society, have made choices in the past to attack it as a community and as a country. And when we can declare something as a national emergency or a healthcare crisis or a public health crisis, it's possible to get much more work done. It hasn't yet quite reached that level of designation, although we're beginning in the area of gun violence prevention to get some funding for research after a 25-year blockage to any federally funded research. So we're making some headway on the issue about gun violence. Recently, if this wasn't enough to convince people in positions of power that we know, I think you probably all know this, but that gun violence and gun death is the #1 cause of death in American children under the age of 20. It's so embarrassing as well as tragic that is the case in our situation. We need to do a lot of work. Now, if that isn't a crisis, I don't know what is. We know that healthcare professionals across all levels of skill and training, whether it's physician's assistants, PAs, nurse practitioners, doctors, nurses, social workers, mental health workers, we all need to do whatever we can to reduce the risks for our patients of all kinds of things that threaten their health and their survival. Lord knows for decades longer we've been asking about smoking of our patients and use of seat belts and bike helmets and alcohol and all the other things that we know are threats to the survival and health and welfare of our patients. But you would be sadly shocked at how sensitive an issue it is now when, in the healthcare office, when a health professional sees you and there's a question about gun in the home and or where your children play and are they safely secured. We have a long way to go in our profession to be able to make that a normal standard question that doesn't trigger a defensive response from the patient population. So we're working on that, but clearly health professionals are trying to do and will hopefully do more to ask about guns and safe storage with that emphasis. We're not going to ask about knowing whether they have guns and how many and what kind, and we're not going to threaten to melt any of their guns down. It's really a question from the health standpoint of reducing risk and asking about guns, but more particularly with an emphasis on safe storage. We need to recognize among our patient populations, especially in the primary care field such as mine, family medicine, the particular groups of our patients who are predictably at risk. Kids, of course, we talk about curiosity. Kids will find where the guns are stored. They'll find grandma's gun underneath her pillow or their grandpa's handgun in the bedside table or under a mattress. So safe storage is absolutely critical. Of course, the best thing is to not have a gun anywhere in the household where the kids are in place, but at least to be stored safely. Victims of domestic violence and intimate partner abuse, you've heard about it already, I don't need to overemphasize how critical that is, but when we, as physicians or healthcare workers, come into contact with patients, there are now some questions that are folded into all the other health risk questions that ask about whether you've ever been forced to have sex, whether you've been hit, abused, you ever fear for your life or your welfare. So asking those questions is very important because that can trigger action, but it only triggers action if the healthcare worker is alert to it and has a plan to refer and get the right resources in place. Depression. We talked about depression. Maybe you all know that over 50%, roughly 60% of all the gun deaths in this nation are suicides. So if there's any profession that has a chance to sort of tap into and recognize people who are already spiraling in depression and signaling signs that maybe they are at risk, particularly knowing whether there are firearms in the home, is critical. And the fourth group, of course, is growing up and living in a community where violence is rampant. We're fairly lucky on the western side of US 23 to have less of a threat, but if you wake up in a community, if you fall asleep at night in a community where you're hearing gunshots 6 nights out of 7, and a number of your friends have suffered either injuries or death because of violence, it's a whole different level of risk. So when we see our patients, if we know that they're at least in one of those 4 categories of patients and they put themselves more at risk, trust me, the dedicated healthcare professionals can, or at least should be, ready to take action and refer in the right direction. I will say that if you've never been asked on an information sheet when you're in to see your physician for an annual physical exam, this is not the everyday short-term visit, but your once-a-year checkup and exam, if you're not on the questionnaire or asked the question about the presence of a gun in the home and or storage thereof, then you need to either educate your healthcare professional to add that question because it's no less dangerous than issues of seatbelts and bike helmets and smoking and drinking. So, and I know there are still a number of physician offices and practices that don't make that a standard question, but there are ways to ask it and find out so that you might recognize patients who are at risk. I know I'm between you and the closure here and some snacks, so the temptation was a month ago to celebrate. Because after years of efforts by lots of people, we finally got a legislature that was willing to not only listen to bills, discuss them, and pass them, but we made progress. And so I felt both elated but very cautious because there are baby steps that we made. But you've heard a little bit about the three legislative motions or moves that were passed. Extreme red flag laws, or ERPOs, extreme risk protection orders, by the way, are the same as red flag laws, which allows people who are deemed to be at risk of harming themselves or others to have their firearms confiscated by authorities for anywhere from 3 months to 12 months and then reassessed. So we do have a way now to try and take the guns away from someone who, before they end up causing much more heartache. Universal background checks finally began to include long guns as well as handguns. We're making progress. And then safe storage. In the anecdote, I went to buy some, or just to price out a few cable gun locks for the sake of convincing the University of Michigan, Michigan Medicine, to have them available for free in the waiting rooms of every one of our primary care settings, family medicine and primary care, family medicine clinics. But I had to get some evidence as to how much they were going to cost and where we were going to put them. I went to the store, in this case at Dunham's, and the guy said, I can't keep any in stock anymore. As soon as that legislation passed, we sold out every single gun lock. So that's progress. Again, baby steps, but we're moving in the right direction. We need to make sure that everybody who does own a gun knows the rules. There are some stories about, I could have a jealous girlfriend report me as a risk and have some judge say that my guns are gone. That's not the way it's written. Judges have many more strict criteria about who qualifies and should have their guns removed for the safety of themselves or others. And there are penalties for people who falsely report this to the system as well, so we need to know that. But we're not done with our work, so not only do healthcare professionals need to continue their efforts, but we as voters need to do it as well. We know about domestic violence. We need to definitely tighten up some of the restrictions on who can be held accountable for their past behavior before they commit any further awful violence, among others, including the strengthening of the way we enforce personal protection orders. We need ways to break the cycle of violence. You've heard mentioned, and you see something printed in the program, about community violence intervention programs, or CVIT is a team that was set up in Washtenaw County. It's getting a little more press now. It was a pleasant surprise when I learned about it. But there are a number of programs trying to capture people who've either been victims or are likely to be victims of violence, in this case, in many cases, firearm violence, to stop the cycle of revenge, shootings, and help people change the path of their lives. And some of the most effective support is coming from people who themselves have been victims and maybe are no longer incarcerated and have learned and are really turning lives around. So the more, I hope in weeks ahead and months ahead, you'll hear more about the community violence intervention team in Washtenaw County. They got a little over $10 million in the budget for community violence intervention created statewide for us this coming year, so that bodes well. So God bless our patients. We hope they have smart enough healthcare providers in the years ahead to take this as seriously as we have some other crises. I will say that the last thing we can do, all of us, is to vote, but vote smartly. So make sure we've looked into the backgrounds and who's funding whose campaigns when we make votes for anything as simple as a county treasurer, township directors. So we've learned, and we're learning clearly now, that the smaller campaigns are vitally important to how we want to turn this country in the proper direction. And then I will last say, keep the faith, and by doing so, we will honor the victims that we're memorializing today. Thank you.